This is James Smith, Nurse Smith, the creator of BioMemorize, and I wanted to redo the video for the using equations conceptually to answer questions in patho, pharm, and critical care. So the first video, we looked at cardiac output, which equaled the heart rate times the stroke volume. And in this video, we're looking at blood pressure. And blood pressure equals the cardiac output times systemic vascular resistance. So in the same way that we saw in the first video that in an equation, what happens on one side of the equation directly affects what happens on the other side of the equation, because it is an equation, it equals, both sides of the equation have to equal each other, so what happens on one side directly affects what happens on the other side. And so, like for example, the first video we saw that cardiac output equaled the heart rate times the stroke volume. So if we increased the stroke volume, that means that we would increase the cardiac output if heart rate stays relatively the same. The same would go for if we increased heart rate. If we increase heart rate and stroke volume stays relatively the same, then we're going to increase cardiac output because it's an equation. So it's a powerful way to understand conceptually what's happening in the body by using these equations. And one of the most powerful equations is the blood pressure one, which I'll do a follow-up video where we can look at diuretics, ACE inhibitors, ARBs, beta blockers, and we can use this one equation to show what happens physiologically, pharmacologically, when we use the different medications for blood pressure. Just this one equation. Because in the same principle, we have blood pressure equals cardiac output times systemic vascular resistance. Well, of course, we need to know what these terms mean. And in the next video, I'm going to define these terms. And then we're going to cover the four or five classes of drugs for blood pressure that would affect these different factors. Right now, this is just a general description. So if we, in this equation, if we, for example, have a drug that increases the stroke volume, that means cardiac output is going to increase, because we know cardiac output equals heart rate times stroke volume. If cardiac output increases, that means blood pressure will increase. So by knowing that a drug increases stroke volume, we can deduce that it increases cardiac output. Now we know it increases the blood pressure. Now, if we have a drug that increases systemic vascular resistance, in the same way, therefore, we're going to increase blood pressure, because this is an equation. This side equals this side, and it's multiplication. So there's only an increase. If one side increases, it has to be in direct effect on the other side of the equation, on the blood pressure. So just briefly, if we just took one example, like for example, nitroglycerin. Nitroglycerin will decrease the stroke volume. We can talk about this in the next video. But that's what it does. It decreases stroke volume. If it does that, it decreases cardiac output. Well, that's on this side of the equation. What would happen on the other side of the equation? It would decrease blood pressure, because it's an equation. So what happens on this side directly affects what happens on this side. And so if you know of a drug that affects this factor, this factor, this factor, or this factor, then you'll know what happens on this side of the equation. And in the next video, there are 3 factors that affect the stroke volume as well. So now you're able to expand it to realize if this, or this, or this, or this, or this, if you know the drug does anything to these factors, you'll know if it increases or decreases the blood pressure. And you'll even know why.